Steph, I have to ask you about, I'm going to ask you about your kids, because we talk about your kids a lot because they're hilarious and they're fun and they keep you going. But lately, they've done you dirty.
Yeah,
they've gotten you feeling a little off. Can you talk about, I'm asking this question like it's part of it's not. But I just am curious if you feel like your immune system is stronger than it was before you had kids.
100%.
Yeah.
I mean, Enzo coughed in my mouth last week, and I'm still here.
I hate that.
Thriving.
Look at that. No one but a mom could survive that incident. Yeah. Yeah.
Yep.
Oh my gosh. Well, y'all, welcome back to the Heart of PHC Podcast, where we dive deep into the stories, people, and impact of primary healthcare. I'm your host, Rylee, and as always, I'm joined by my amazing co-hosts, Moises and Kirstin.
Hey, excited to be here today.
Hey everyone, we've got a very special guest on our show today, so let's just get right into it.
Yes, today we have a truly special guest with us, Stephany Balow, our Chief Administrative Officer here at Primary Healthcare. Stephany has been a key part of the organization for some time, and we're thrilled to have her on the pod today.
Yes, Steph has played such a crucial role in helping shape the structure and growth of PHC. We're really excited to hear more about her journey with us.
Absolutely. We're going to talk a little bit about Steph's journey today. We're going to talk about her role as CAO, or Chief Administrative Officer, and how she's kind of seen the organization evolve over time. So, Steph, thank you so much for joining us today.
Thanks for having me, y'all.
Yes, Steph, we're excited to have you. So let's start with the basics. You've been with PHC for quite some time now. Can you share with our listeners a little bit about your journey and what led you to become our Chief Administrative Officer?
Yeah, absolutely. So I started here going on 12 years now. So
That's a long time.
I've been here
Congrats.
a long time.
Yep.
So I actually started out as a temp. I was our former CEO's executive assistant and came on board full time about a month in. And at that time, she was like, you know what? I know that you want to do other things. I had a master's in healthcare administration, so she knew that I really wanted to be in some sort of leadership role. She's like, I need you to commit to 2 years as my executive assistant.
Which is a long time. I mean, let's just call that out, right? Like, that's kind of a long, but you were like, all right.
Yep. I was like, I'll give you those 2 years. And she said, in those 2 years, I'll let you do and experience whatever you want. And it was the best crash course in what is healthcare, what does it mean to be a healthcare administrator. And then, ironically enough, there became needs around compliance and risk. And so I identified those needs. We had plans, but they weren't operational. And she said, run with it. Connected me with a mentor down in River Hills who was a compliance officer, and really started to build that arm of our organization. And so after those 2 years, I became our compliance director. And as things changed in the regulatory landscape, risk became even more important, especially for FTCA, which is our malpractice coverage through the federal government. So I took our risk management plan and then operationalized that and just continued to grow from there. So my role is really grown out of needs and changes in the environment. So it's kind of cool to see, I'm one of those unique people who we've created positions just out of need, and I've happened to grow into that. And that's how I came to be in the CAO role as well. So yeah.
What a special kind of experience to have, where something that you were passionate about also, like that very sweet overlap of just, I want to do this, and the organization doesn't have it. I mean, you could have been in a position where you were seeing somebody, tackle that, and you were like, oh, that's kind of what I want to do, and then, trying to navigate your way up a ladder, but essentially you were just doing what you felt called to do.
Yeah, exactly.
And it worked out great. So really cool story.
That was really cool.
No, it's awesome. Over the years, we've seen PHC grow in so many ways. How have you seen the organization evolve since you first joined, and what stands out to you the most?
Well, that's a great question. So, I mean, like I said, I've been here going on 12 years, and so when I started 12 years ago, we were probably half the size of the organization that we were. And I've seen us add clinics. That's another part of my job. So as we add sites or change sites, change hours, I have to go and put that into HRSA and get all of that approved. So I've seen us add our West Side clinic. I've seen us add dental in Ames. I actually was here. We used to be in Ames, like in a little spot off of, was it Duff Avenue? Kind of over by, I don't know if it was Duff, but saw us move into our now permanent location on Lincoln Way. So it's been really cool to see how the organization has changed, not only from like a footprint, like in our service area perspective, but then also the diversification of services that we provide. So, you know, I helped Dr. Shrek back in the day write grants to get school-based clinics implemented. And that was the one thing that I really love about my job is I can kind of be on that innovative forefront and helping to support operations, to make those expansions and see like a need in our communities where there's a gap and we need to, that's one thing we've done as PHC is like we've always been the one like, oh, we need to fill that. And so from like a organizational mindset and change, I've seen like, okay, we need to be everything for everyone and we need to fill that gap, to kind of scaling back and being like, okay, where can we fit in? Are we the best provider to really fill that gap? Or can we leverage our community partners and say, you know what, let's collaborate together, but maybe not be the one to completely lead. So it has been interesting and nice to see that because now I see us kind of getting back to our core and understanding this is what we need to focus on, this is what we're great at, and continuing to build more partnerships to ensure that our clients and patients have the services that they need.
And I think it's important that somebody like you, with the experience that you've had seeing PHC kind of evolve from half its size to, oh my gosh, all of these gaps exist and we've got the means to fill it, let's fill it, to then let's scale back and say more meaningful yeses, basically. And yeah,
we're way more intentional now, I think, about how we're pursuing opportunities. So before, you know, a grant would come up and we're like, oh yeah, there's that need in our community, let's apply for it, let's try to go out for bid for it, and then we get it, and then it would be hard because it would be spread so thin. We were providing a great service and some of those services are still absolutely here, but now we're very much intentional about, yes, let's pursue that grant opportunity because it aligns with what we do as an organization and what our patients need versus, okay, well, maybe we should let this organization know about this opportunity because they're better suited.
Yeah. Can you talk a little bit about what your day-to-day looks like now and what are some challenges that you kind of face in your more recent role?
Yeah, so my job has a pretty large scope. So I serve as PHC's compliance officer, so I oversee our compliance for the entire organization. I'm also our risk manager, so I oversee risk management for our organization. And then act as our privacy officer, but then I also oversee a number of our administrative departments. So community, oh my gosh, communication, it's 6:30 in the morning.
And we've been saying community quite a bit. We've been saying community a lot.
We record quite early.
Yes, we do. They got me out of bed before dawn. So I oversee marketing and comms, IT, HIT, facilities, our clinical training, infection control, and patient safety as well. So hopefully I'm not missing anybody.
I know. Sorry. It's like the list goes on.
Yeah, so I mean the scope is large, but I mean a lot of what I do on a day-to-day basis is the risk and the compliance side of things. And my day looks different every day. So it just depends on what's the biggest fire today. I always describe my job as like, I'm going to keep you out of jail and I'm going to put out fires. But so I think it's challenging in my position because I very much want to be proactive in building the systems so that we don't have to be reactive, but we're still growing. I'm a department of 2. Jess Torius, my compliance manager, she helps me a lot. She's my right-hand lady. So shout out to Jess.
Yay, we love Jess.
But yeah, I mean, it just depends on what comes up. So I really want to move more towards that proactive state, but a lot of it's just reacting to what does the organization need at this time. Doing a lot of advocacy too about what's going on in the environment, both from a state, local, and federal perspective. So, I mean, it's very interesting. There's never the same day.
For sure.
I like that. Yeah.
Yeah.
Well, we're living in a time where the healthcare industry is constantly evolving. With the rapid pace of change, how do you stay ahead of trends and ensure PHC remains at the forefront of providing quality care?
Yeah, that's a great question. So I lean on our primary care association a lot.
Oh,
so they are very much tapped in at the state and federal level, just in understanding what's going on from a regulatory perspective. So on committees with them, listservs are awesome. So all the listservs that I can be on, CMS, HRSA, various HRSA ones, Joint Commission. So it's a matter of really digging into those resources and understanding, okay, what new changes are coming? What can we anticipate? I mean, I really don't like to watch the news right now, but I feel like in my role,
Does anybody, right?
right? But in my role, I feel like I have to just to understand, okay, what are we possibly going to be up against? But one thing that I've learned in my role is understanding what is our true resource and what are we considering the source of truth, because especially right now, and especially since January, it would be very easy to feed into some of the fear mongering that's happening. So it's really understanding okay, how do we need to respond? How do we not incite undue panic? And that I think has been somewhat of a challenge because there's so much mis and disinformation out there. Understanding, okay, this is who I know that I trust and who we can trust as an organization that is our source of truth. So, and a lot of that comes from the PCA, or it comes from our advisors at the federal level that we work with. NAC is another one as well.
And that's so meaningful because I think having somebody in your position who can really kind of model that for the organization and lead us through those, challenging times, because I think, and not that you do it alone, Steph, but that's, we're unfortunately so targeted in a lot of ways. And I think, the work that we do, the organizations like us, I think, could be in a position to respond to that in a way that's unproductive and in a way that ultimately is going to hurt our community. So
and I think you have to understand what's your risk tolerance and what, as an organization too, can you, how do I want to phrase this? I mean, it's a spectrum. Either it's all on one end, it's you're completely risk averse, or you know what, you're okay and you're comfortable and you're able to take those risks. And there's certain things, it's not just about a mindset. Yes, there's definitely a mindset is a big part of that, but it's also as an organization of where are you at financially, operationally. So there's a lot that goes into that culture-wise, where are you at as a culture, and understanding how the decisions that you make can impact all of those things. So.
When you think about your time at PHC, what is one moment or project that stands out to you the most as something you're really proud of?
Yeah, so I've had an opportunity to be really creative in my tenure here. And so I'm very thankful to the organization to have really had that latitude to grow programs. But I think, and I know we're going to get to this later, but I think my biggest sense of pride has been the development of our risk management program. So I want to say we really started to build it up in 2016. And so, yes, we had a committee in place, we had a plan, but reporting of events was very low. We would maybe have 100 events reported in a year.
Oh, wow.
Which is...
Well, that's just not accurate.
Exactly. You're absolutely right,
missing
though,
out
Rylee.
on a lot.
We were missing a lot of what's going on in our organization, because you absolutely know that near misses in particular, you're probably seeing 100 in a month. And it's still underreported. But so what I realized is it wasn't just about the reporting and the number itself. It's okay, understanding the human behavior behind it. Why aren't people reporting? Is it a training issue? Is it a culture issue? And it was a little bit of both. People didn't understand the importance of risk management and event reporting. But I think there also is fear, because historically in healthcare, if you're reporting an event, there's liability assumed as part of that. And so organizations had to really change the way in which they're looking at risk. And event reporting is the way that you manage it. Like, if you don't know what's going on in your environment, like, you can't change behavior, you can't change processes to prevent harm from occurring. So I really pushed our culture of safety, which is more of a systems focus rather than being on leading with individual blame. And I really saw that shift within our culture, and that's a big deal. I mean, it took like a few years. I mean, at least 2 to 3 to really see that mind shift, and to get people talking about event reporting, culture of safety, and really starting to embed that into our language. So the fact that we're where we are at now, and people feel safe to report, they're not concerned about getting in trouble for reporting something. They understand that the whole point of reporting an event is to drive systems change and not to place blame, I think is my biggest sense of pride, because it not only helps us as an organization, but it also makes our patients safer.
Absolutely.
Very true.
Yeah.
And it's cool to see that's not only become something that people are privy to and talk about, but that it's the standard. Like, it is something that we value enough as an organization that we train on. Like, you do annual training and more on just psychological safety on its own.
Gonna do that this afternoon for leaders.
Hey.
Oh, nice.
Excited. Oh my gosh, yeah, that's right. I think I'm going to that session. I've been to it, but I like to pop in when I can. I would love to hear, if we can kind of pivot a little bit to just so you were talking about your career, and you've had such a unique journey. If there are folks listening who are interested in healthcare administration, something like that, and they want to pursue that career, is there advice that you would pass on to them?
Yeah, a healthcare administration degree, whether it's a bachelor's or a master's, is pretty diverse. So I guess, like, when I started with the organization, I'm like, ooh, I think I want to be a clinic director.
Oh, wow, that's funny.
I absolutely did not become a clinic director. And I love what I do. And I think, too, like, I was one where I wanted to get my foot in the door. And I knew that if I put in the time, I put my foot in the door, it was going to eventually, hopefully, lead me to where I wanted to be. And I had no idea at the time where it actually would lead me. Like, did I know 12 years ago that a CAO even existed? Absolutely not. But here I am today, and it's really just looking for those opportunities to learn, to mentor, to really talk with those leaders. And that's one thing that I love doing as a leader, is providing people with that opportunity too. Like, I am always willing to take time out for anyone to stop in and just have a conversation. And I love the mentoring aspect, because I think that's when people are learning the most. Like, so it's seeking out those opportunities, seeking out the information to grow, and just expect the unexpected, because like with my job, every single job that I've had here, other than when I started, didn't exist. So you don't ever know what's going to happen. I mean, healthcare is so dynamic. You don't know what's going to happen within an organization. So continue to look for those opportunities for change and for growth.
That's something that, Steph, you actually told me, I don't know, probably 2 years ago now. And it stuck with me. And I've shared that with other people, and I always cite you. But I just thought it was such meaningful advice, and it's carried me through some tough times, I guess, of just kind of like, you don't know, I mean, on a very granular level, you don't know what tomorrow holds. And tomorrow might be the day that you love your job again. But also, because we all have those moments. But also, it's that thing of like, you don't know what needs are going to arise that you are the exact right person to fill. Or you don't know what opportunities are around the corner that you are the exact right person to take advantage of. And I just find that to be so true. And when you said that, I was like, gosh, that resonates. And so I've continued to share that with like our emerging leaders, even, because I think it's really easy to, and I know I'm sorry I'm going on a tangent, but I just want to,
please,
I just really want to like, especially for our listeners, like, that are really driven and career motivated, like, and especially at PHC, like, you might think this is the path. Like, I want to be a clinic director, and these are the things, and that's great, and it's good to have a goal, but you simply don't know what might come up and what you might find that you're passionate about. And I think that's one of the coolest things about PHC is that we are that's more than likely going to happen. Right. So I love that.
Yeah. So one thing we hear more and more in healthcare conversations is the importance of a culture of safety and psychological safety, create an environment where team members feel safe to speak up, share concerns, and learn from mistakes without fear. Why do you think fostering that kind of culture is so critical in a healthcare setting? And how do you see it playing out at PHC? And I know you've touched on this a little bit, but if you could expand on that.
Yeah, so the work that we do in healthcare is highly interdependent. And what I mean by that is if we can't work well together as a team, our patient outcomes are not going to be as great.
Oh, yeah.
Yeah. So if you don't have trust or psychological safety at the very basis of psychological safety, it's rooted in trust. And so if you don't have trust among those team members, people aren't willing to speak up and raise concerns. They're not going to collaborate together and look at what's going on with the patient. They're not, if they see something that's wrong and they don't feel safe to speak up to the provider or another person on the care team with something that was done in the visit, that patient is the one that ultimately will suffer. And so, like I said, we have to be functioning well and working safely and trusting one another because our patient and our client outcomes depend on it. So that's why essentially I feel culture of safety is most important because it's what's best for the patient. And from a culture perspective, it's best for our teams too, because if you're walking into an environment every day at work and you feel that it's toxic and you don't like to be there, our patients are going to feel that.
Sure.
Our employees, our other employees are going to feel that, and it's just going to brood more and more toxicity, which isn't good for anybody. And then from just a theory perspective with culture of safety, and I touched on this a little bit already, but that psychological safety to speak up when there's concerns or to raise awareness to adverse events and near misses, those are our opportunities to improve our systems to, again, just make things safer and provide higher quality care.
Yeah,
absolutely.
And
go ahead.
I was going to say, I think there was a second part to that question that I missed and maybe I already answered it, but it was...
No, you got it.
Okay, I did. I was like, how does it look at PHC? So
yeah.
All those things.
Yeah.
Steph, before we let you
that
go, we wanted to ask you, how do you live out our RK values?
Yeah, so I think I come to work every day with a sense of integrity. I mean, you can't be in compliance without having integrity. And really it's through... I come into a lot of sensitive situations, and so it's treating that with privacy, but then also leading with that compassion. So one thing, it would be really easy as a compliance or a risk manager to be very, very black and white. But one thing that I think I at least try to do is bring that balance and understanding that it's all living in the gray and understanding the human impact side. And so whenever I walk into a hard situation or an investigation, recognizing that not only in those situations is a patient potentially harmed, but likely that employee is feeling terrible too. And giving people the chance to really speak their truth and their side of the story and not walking in with any judgment. And so, I really pride myself in really trying to have that balance. And then I think finally it's that access part. So I feel like I'm very accessible.
You are.
Absolutely.
Yeah.
So, and I think I do that because, again, it's the nature of my work, but just also who I am as a person. So I want people to feel every day that they're supported and that what they receive from me is that support and that access and that love and care.
Yeah. And I do think that comes through Steph. I think I mean, I hear people talk all the time about just how great you are to talk to and how accessible you are and approachable, and you do have a gift for making a really complicated and potentially like what could be a really shameful situation feel like something that people can navigate and get through. So thank you for doing that. Thank you for being on the show with us this morning.
Yes,
it is so great to get to sit down and talk to you about your role and your journey. So we're really grateful to have you.
Yeah. Well, that's it for today's episode of the Heart of PHC podcast. Thank you for tuning in. If you enjoyed today's conversation, be sure to subscribe to us on YouTube, Spotify, or wherever you get your podcasts. Support the show and stay updated on future episodes. See y'all next time.